Hello everyone, this is Kumar here. I'm again back with another Wednesday talks on health insurance as requested by many subscribers. So I'm creating this video on health insurance. Okay. Uh, what are the different modules that I'm going to cover here today is I'll be giving an overview about the health insurance. What is health insurance or what are the different plans? What are the different coverage? And and so on, many other things that I'll be giving it as part of the introduction to health insurance. And then we will focus on like different modules that IT teams they would be working on. And also we will talk about some real-time scenario of how this health insurance modules are connected to your project. And then finally, we'll be checking on how mainframe is used in health insurance, like how this technically works, right? So I'll be showing you something about that. Okay, so stay tuned. Do not skip or anything. So just stay tuned for the next things that is coming up. Okay, yeah. So let's start with an insurance overview, right? So what is an health insurance? So any person would definitely need a health insurance. So why we would need an health insurance? Health insurance is like it's a way of people to pay for their any kind of a medical expenses. It can be like doctor visits, hospital stays, or you need some medications with that with a prescription and any other medical services that may you encounter in your day-to-day life, right? So for that reason, so you would definitely need a health insurance. So in order to get a health insurance, what is typically needed? Typically, what how this works, right? Normally, I'm talking about especially about the US uh, health insurance. So typically, what they would be doing is individuals pay a monthly fee. They call it as a premium to their health insurance companies, and in exchange, these insurance companies agrees to pay for portion of the medical cost, which can vary depending on the type of the plan and the specific policy that has been chosen. Okay, some health insurance plans requires individual to pay a certain amount out of pocket before the insurance company starts paying for medical expenses. We will talk about that, what is out of pocket and deductibles. Okay, so that insurance company will typically pay for a percentage of the remaining medical cost while the individual pays the rest. Okay, so many people get health insurance through their employer as part of their benefit package. If you are working for so and so organization, so that cost is bear by employer. Sometimes it would be like partially. So employer may be contributing 50% and the employee may be contributing 50% and so on. So there will be different things. Okay. Others, if you want to buy an individual insurance, you can buy that as well. Uh, Okay, and there are some other programs like Medicaid, Medicare, so which are designed to provide coverage to low-income individuals or those over a certain age, right? It is very important to note that health insurance policies will be varied widely. Okay, so but as per the regulatory, they follow certain rules, and it would be common in any kind of an health insurance providers that they may be selecting for. Okay, yeah. So normally, in a health insurance domain, provides medical coverage and financial protections to individuals or groups of individual against the risk of incurring medical expenses. The health insurance domain is a complex, I can say, and highly regulated industry that involves multiple stakeholders, that is including members, insurance companies, healthcare providers, and government regulators. All these together, so they have certain agreements and they run these things. Okay, so I repeat this: the health insurance domain is a complex and highly regulated industry that involves multiple stakeholders, starting from members, insurance companies, healthcare providers, and government regulators. Right. Okay. What are the different health insurance plan that an individual can take is like the first thing is about the medical, then they can take about the dental and vision. So these are the different plans they have to take, and based on the plan that they have taken, and they would be paying a premium. And there are chances like they may be paying a premium separately for medical, dental, and vision. Okay, and some of the organization, if you're working for a specific employee, so the employer would be paying on behalf of you for the entire thing. Okay, that as part of the benefits. Okay, and now let's look at the tax advantaged accounts. So there are two types of tax advantage accounts. One is HSA and FSA. So along with your medical, dental, vision, whatever the insurance plans that you take, so there are two other kind of accounts. They call it as a tax advantaged accounts. One is HSA and FSA. HSA and these are like what is HSA? HSA is a tax advantage saving account that can be used to pay for qualified medical expenses. It's like it's like a card which every month from your salary some amount, certain amount of money will be added to that particular card. Okay, and you can use that money for the medical expenses. So that is nothing but a health saving account. Similarly, you have flexible spending account. It's like a preloaded card, I can say. So for the entire year, so you will be loaded with certain amount, and you can start using that specific card. HSA, this can be if you are leaving an organization and you are moving to another employer, still that HSA account would be valid, and you can roll over to the next upcoming years, and the fund would be still available. You can use it at any time. Whereas coming to the FSA, so it will have a certain I can say restrictions. At the end of the year, I mean, if you have taken the FSA January 1st and after the December 31st, or maybe few 30 next year January 30, you have to utilize that amount. If you're not utilizing, then it will be like wasted, right? It will be like unused funds. So that these are the two tax advantage accounts that they use. Okay. And some other important terminologies that you may be coming across when you're working in a specific domain, health insurance projects like in-network, out-of-network, out-of-pocket, deductible, co-pay, co-insurance. These are the other terminologies that you would be coming across. And especially even when you are taking any insurance, so this you might be seeing. I mean, these are the different things that we need to consider while purchasing an or while taking an insurance or from an employer if you're purchasing. So these are the important points to be noted. What is in-network? In-network is nothing but it refers to the healthcare providers such as doctors, hospitals, and clinics who have a contract with the health insurance plan that you have a take that you have taken. If you are suppose for medical treatment, so if you are visiting any in-network providers, so then you would be getting few discounts and the better service, right? So the cost would be low if you are visiting an in-network. Suppose out of network refers to the healthcare provider who do not have a contract with your health insurance plan. When you visit an out-of-network provider, your health insurance plan covers a smaller amount of the cost, and you may have to pay more out of pocket. For example, if you visit an out-of-network specialist for a medical procedure, you may have to pay a higher percentage of cost, that is like 50% more than that you were paying for the in-network. And there are other terminologies that we use like out of pocket, deductible, co-pay, and co-insurance. So what is deductible? A deductible is nothing but it's the amount of money you have to pay out of pocket before an health insurance plan starts covering your medical expenses. And it all depends on the plan that you are purchasing. There may be a plan of a deductible of $500, $1,000, or 1,500, 3,000, and that way. So higher the deductible, so lower the premium. Lower the deductible, higher the premium cost. So it varies vice versa. Okay. And then you have like copay and co-insurance. Copay is something like it is a fixed amount of money that you have to pay for any kind of a medical services that you are taking up. For example, so you have visited a doctor and as per the insurance, so you have to pay certain $30, $60 or $20 as a copay. So whenever you visit a specialist. And similarly, the co-insurance. Okay, co-insurance is nothing but it's a percentage of cost of a medical services that you have to pay out of pocket. Okay, 20% co-insurance that way it will be there. Okay, yeah. So this is about the few terminologies that we'll be using. So why health insurance is important? The medical expenses can be very expensive. So we purchases health insurance. Health insurance provides financial protection against the risk of incurring medical expenses, and it allows you to access healthcare service without worrying about the cost. How health insurance works? So you will be paying a premium to the health insurance company to enroll in a health insurance plan, and then health insurance plan covers the cost of medical expenses up to a certain limit depending upon the plan you purchase. When you need a medical care, you can visit a healthcare provider who is part of the health insurance plan network. Okay. Types of health insurance plans. There are several types of health insurance plans, including like individual. If you want to go and purchase the individual health insurance, yes, you can purchase group health insurance, as I said. So when you're working for a specific employer, so they would be having a group plan. So you will be paying a less premium when you are taking a group plans. And then there are Medicare and Medicaid for low income and the senior citizens. 60 plus above people are there, so they can take that particular plan. Okay. So the next coverage under health insurance plans, like what are once you take the health insurance, so what will be covered? So it will be covered like doctor visits, any kind of a hospitalization like inpatient, prescription drugs, emergency services, preventive care, and all this would be covered under the insurance. Okay. And what would be the cost of an health insurance? The cost of the health insurance, it's purely depends upon the several factors, which can be like type of plan that we have taken and the coverage amount, age, and health status. And so these are all the factors that would be depending on it. Okay. Now coming to the very important thing for the especially working in an IT project, so under health insurance. So what are the different modules that you may be working or you are working is? So it can be from any one of these modules that you are seeing here. So it can be like enrollment and eligibility, claims processing, provider network management, policy administration, member services, ID card, reporting and analytics, compliance and regulatory. Right? So this can be you may be working in any of these modules. So it's not that in a year you'll be working on all these models. So someone may be working only in the claim processing from 15 years, 20 years. You will be still seeing that, right? Some may be working completely in the environment eligibility from 10 years. So there are like the subject matter experts or the business analyst experts, so who will be specifically dedicated to the specific modules. And there may be a few experts who are very much worked on all different modules. It takes a lot of time to understand the system, process, technology, and everything. Okay, so let's talk about the enrollment and eligibility at a high level. So this module handles the process of enrolling members into the health insurance plans and determining their eligibility of coverage. It includes features such as online enrollment forms, eligibility verifications, and members onboarding. So all this could covered in enrollment and eligibility. Okay. Next is a claims processing module. In this module, the process for submitting claims, adjusting claims, paying claims, and all this would be as part of the claims processing and also the payment processing. Okay. Providers Network Management module. This module manages the network of healthcare providers that are part of the health insurance plan. It includes features such as provider network directories, provider credentialing, and provider contract management. All this would be in a provider network management module. Then they have policy administration module. This module handles the administration task related to managing policies such as like policy setup, renewal, cancellation, and underwriting. It includes features such as like policy setups, forms, policy management workflows, and policy document management. All this would be basically all the provider information or provider things, provider administration would be manually. And this is also one of the biggest module I can say. So where it mainly deals with the setups, renewal, cancellation, underwriting, and all these things. All the policy things would be there, right? And sorry, I mean to say policy administration that they will be taking care, right? And in the policy administration, okay. Suppose they want some of the in-network hospitals to be tagged, or some may not be agreeing with the policies that's been set by the health insurance companies. So they may not want that to be in-network, right? And then they have like member service. So this module provides various services to members such as like online access to their health insurance information, customer support, and members self-service portals. Okay. It's all about the member profile management. And then next, obviously, the reporting analytic module. This module provides insights into the health insurance system's performance and metrics. It includes features such as like dashboards, reports, data visualization, and the tools. And then they have as every organization will have this compliance and regulatory. So like they have like various regulatories, health insurance systems in complying with various regulations such as like HIPAA, ACA, and state-specific regulations would be there. In I mean features such as like for compliance monitoring, auditing, and reporting. And similarly, there is an ID card module. This module allows users to generate and print insurance card for their members. And it includes features such as like member information, management, ID card template design, printing, exporting of ID card. What I would say is overall, all these modules works together to provide a comprehensive health insurance system that automates and manages various aspects of the health insurance process, which makes them easier for the members, for the providers, insurance companies, and everyone, all the stakeholders. Okay, so now let's talk about how things works in the real life projects, right? So first thing is you need to understand the health insurance domain and you have to identify the requirement, choose the technology stack, develop the application, test and deploy. Let me tell you in detail. Like what do you need to understand the insurance before you start working on this project? Essentially, you need to understand about the health insurance domain and the various stakeholders involved, like such as like who are the members, insurance companies, healthcare providers, government regulatories, and so on. And you can research on this anywhere, right? And then next, you need to identify the requirements. Once you have a good understanding of health insurance domain, the next step is to identify the requirements. So, like as I said, this involves working closely with stakeholders such as like project managers, business analysts, subject matter experts, and to gather and document the project requirement. So basically, you need first you need to understand the domain, and then you need to understand who are the stakeholders, and from where you will get the requirement. Then finally, you have to look at the technology stack. After you identify the project requirement, the next step is to choose these technology stacks, right? So you can choose technologies like ASP.NET, Angular, React, SQL Server, Oracle, MySQL. So what kind of a technology stack that is being used, or based on the module that you are working on. So then you will be working on the applications. Like either it can be a batch, Windows batch applications, or it can be an online application, web application using .NET Core or ASP.NET or any other Java-based applications and everything. So where you'll be working on. Then finally, you'll be testing that particular application that you have developed or enhanced, and then finally you'll be integrating and doing some unit testing, and then finally you'll be deploying. Okay, now let's look at the very important one, how it is used in a mainframe, right? So in mainframe technology has been used extensively in the health insurance industry for several decades, I can say. Mainframes are used in health insurance projects primarily for their reliability, security, scalability, and processing power. I can say like the some of the important modules in used in health insurance are like first is the claims processing. Mainframes are used to process health insurance claims from providers. Mainframe system can process high volumes of claims in a short period of time, and they have designed to handle complex rules and calculations involved in determining claims payments. Okay. The next very important module is the policy management. Mainframes are used to manage health insurance policies, including enrollments, premium billing, and policy maintenance. And Mainframe can track policy changes and updates, process premium payments, and generates invoice and statements. And then what about the data analytics? Mainframes are used for data analytics in health insurance projects. Mainframe can store and analyze large amount of health data to identify trends, patterns, and anomalies, I can say, that can be used to improve health insurance outcomes and basically to reduce the cost. The next is a fraud detection. Mainframes are used for fraud detections in health insurance projects. Mainframe can identify suspicious pattern of activity in health insurance claims and flags them for further investigation. And then customer services we have. Mainframes are used for customer services in health insurance projects. They can provide real-time information to customer service representative about the policy information, claim status, and other relevant information that is requested. Overall, I can say the mainframe have been critical to the health insurance industry for their ability to handle large volume of data, process complex calculations, and provide reliable and secure system. Okay, so that's it, guys. So this was all about the health insurance and the overview of health insurance and how different modules are being used. And if you're working in a health insurance, so you may be for sure working on some of the any of those. And so that's it for today. Thank you so much for watching this video. If you do like it, please do like, comment, share, subscribe, and have a wonderful day.